Good evening, everyone. My name is Jonathan Landsman. I'm our board chair, and I'm going to bring this meeting to order. First item on the agenda is a roll call. I'm sorry, first item on the agenda is the Pledge of Allegiance, so we'll stand for that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay. Next on the item is roll call, if you would, Victoria.
Mr. Young. Mr. Furman. Present. Dr. Hahn. Mr. Landsman.
Present.
Ms. Newman.
I am on the keyboard. Wait, Dad, can you go back now? Go back.
Dyer.
Here.
Mr. Cohen.
Here.
Ms. Root.
Here.
Dr. Taub. Ms. May.
Here.
Ms. Woodruff. Present. Mr. Therese.
Here.
All right, thank you. Next is our first opportunity for public comment. We have a second one at the end of this meeting, in case you haven't signed in, but is there anyone that wishes to provide public comment? First online.
Actually, yes, there was an individual who would wish to provide public comment on the online forum. So the name is Carlotta Wolf, and she would like to do it at the first opportunity, and she would like to read her own statement. So Carlotta, are you online? And if you are online and on the phone and you need to unmute, you would do a *6 to unmute.
That was Carlotta.
Yeah, and the name is Carlotta Wolf.
Ms. Wolf, if you're on the call, we cannot hear you. We'll give you another half minute or so to try to clear the line. Okay, Ms. Wolf, we will give you an opportunity at the end of this meeting to try public comment again. Is there anyone here in the building here? I see some other faces from the public. If anyone wishes to make a public comment. Okay. Hearing none, we move on to the next item on our agenda, which is introduction to our new board members. So if you look about us, we do have some new board members. We have 3.
Hi,
Sarah
I'm so
May
sorry to interrupt. I was wondering if I could
Yes.
make public comment.
And you are whom?
My name is Shayna Lee.
Okay, let's go ahead, Shayna. Yes. What do we need for? Okay. Okay, go ahead.
I'm sorry. Okay. So just briefly, I am a parent of an 8-year-old daughter that receives services from OCHN, CMH, has received services from Middle Ground, various psychiatric inpatient facilities. And I'm not 100% sure if I'm going to phrase this correctly because I just thought of it today, so please excuse me. But I was wondering what OCHN does in relation to the police and in relation to what conversations the two bodies might be having or trainings that the two bodies might be doing together in order to ensure that children like mine with severe mental illness are not only being taken seriously by the police, but that the police are aware of the state of mental health for children like mine and not just insisting, let's say, that they go inpatient without necessarily understanding the ramifications of that and the lack of services and the notion of us sitting in emergency rooms for weeks and weeks and weeks at a time.
Is that the end of your public comment?
Yes.
Okay. First of all, I want to thank you for taking the time to join our meeting and have public comment and speak up. So we appreciate that very much. Our practice has been that we will take that information in, have our folks look into an answer, and then provide that answer both to you and to our board. Okay? So we might also ask you for some additional contact information. And is there a number or a place that she can send it to so that we can provide that insight back to?
Yes, we're working on putting that link in the chat right now, but there is also an opportunity on our website that you can go in and fill out that public comment form at the link that's noted on the slide, the oaklandchn.org. And then there is an area where you can provide public comment, and then we will have that contact information to respond back to the person.
Okay, but please make sure you noted that you made the public comment during this meeting so that they know specifically who you are. Okay? And again, we really appreciate it. I know with the pandemic, it's been hard to get public comment, public involvement at the meeting, so thank you so much for speaking up. Okay. So going back to our board agenda, so the introductions here are to John Young, who's to my left, a couple of tables down. Welcome, John. Yvette Woodruff and Sarah May to my right. Both of them have been, this is their second board meeting, but I just wanted to as well recognize them, all three of them, as joining our board this year. So welcome. We appreciate it. It's good to have a complete board, so thank you very much. Okay. Next on the agenda is stories. Actually, you know what we need to do is we also need to have a motion to approve the agenda. That wasn't on there yet. So before we start with stories that inspire, I need to have a motion to approve the board agenda.
This is Christina. I make that motion.
Thank you, Christina. And I need a second.
Support.
I'm sorry, which way? Support. Okay. Thank you, Mr. Cowan. Any discussion? Nope. All those in favor say aye.
Aye.
Okay, the motion carries. Now we'll move over to Stories That Inspire, which is my favorite part of all of these open meetings.
Thank you so much. My name is Suzanne Weinert, and I work on the communications team, and it's my pleasure to provide you with not one, but two stories that inspire hope this evening. In recognition of the National Developmental Disabilities Awareness Month last month, OCHN honored two outstanding individuals at our annual Abilities Awareness event, which was held on Tuesday, March the 8th. It was a virtual event, so anyone can view that virtual event on our YouTube channel. They can get to that link through our website at oaklandchn.org. And the program this year highlighted notable achievements of our champions, of course, but it also showcased the importance of voting and advocating for individuals' rights. Most importantly, though, it did honor our Abilities champions for both MORC and Community Living Services, or CLS. And these two individuals, they embody resiliency and positivity while also being very productive, contributing members of the community. Hannah Ritchie from MORC and Cheryl Stumbaugh from CLS are this year's Abilities champions, and both are just extraordinary individuals, and you're going to hear all about them. We're going to start out with Hannah. Hannah is a very talented artist. Her crafting and unique creations, she sells them through her own business that she created, and it's called Hannah Joy Spectrum Designs. So first off, I would like to welcome Hannah so she can tell her story. So if you want to unmute Hannah, and you can tell your story to the group.
We have an audio issue again, but I know Hannah's not on mute.
Hannah, hold on one second. We're working on the audio issue.
She's on her laptop.
One minute while we work out these technical issues, just 1 minute.
Is there a mobile phone, Hannah, that you can use to call in? And since we can't hear you, you just have to nod because you're on camera.
Hannah, could you unmute yourself? Mute it and then unmute it and see if that helps. Hannah, we're going to ask if you could leave the meeting and then rejoin the meeting, and that will hopefully reconnect you. And then we will just have Cheryl go ahead and present. Does that sound good? Thank you.
Thanks, Hannah.
Okay, can you hear me?
All right, we've got to improvise with some of these technical issues. So now we'll move on a little bit and we'll talk about our additional CLS Abilities Champion is Cheryl Stumbaugh. And I do want to note that Cheryl did send me some slides earlier today that I will be happy to share with the board. We'll share those with the board later. We didn't have an opportunity to put them into the PowerPoint presentation, but I did want to talk a little bit about Cheryl. Cheryl lives in her own home with her service dog, Zen, which I'm sure we're going to hear a little bit about. She has worked as a social worker through Beaumont Hospital, assisting people with disabilities, as well as being a peer mentor for community living services. So now I would like to introduce Cheryl.
Hello, everyone. My name is Cheryl Stumbaugh, and I am a self-advocate and a clinical social worker. I have the medical diagnosis of spastic quadriplegic cerebral palsy. As she stated, I am a dog mom to Zen and an aunt to two lovely nephews. I navigate the world in a power wheelchair. I'm also able to drive my own vehicle. Throughout my time in school, I went through special education services with the emphasis on job employment and life skills rather than academics, given the extent of my physical disabilities. And in middle school, I remember asking one of my special education teachers, or telling my special education teacher, that I wanted to go to college and become an occupational therapist. And she replied, "People with your disabilities don't go to college." So I just put that little seed in the back of my head and moved on to high school. And once again, went to one of my special education teachers and asked, told them that I wanted to go to college. And she again replied that people with the extent of my disabilities didn't go to college, and the ones that did go to college was because they had a really supportive family. And their family was able to help them through, and that wasn't going to be my case. So luckily for me, though, I was still in the time where people could graduate with a diploma while receiving special education services, and that allowed me to open the door to community college, where I spent 8 years learning the basics that I did not learn through the public school system. I then moved forward to Madonna University, where I obtained my undergraduate degree in social work. And also after that, I all of my peers were saying that they were applying to graduate school and asked me where I was going to apply. And I thought to myself, wow, I never really thought about going to graduate school. Like, didn't even want to go to get a bachelor's. I just wanted to get an associate's degree because for when I first started my career, I worked for the Center for Independent Living, Oakland and Macomb. And whenever I would advocate on behalf of students, teachers would often ask, and who are you? And all I could reply back is, well, I'm Cheryl, an advocate. And I learned very quickly that being Cheryl the advocate wasn't going to be enough to really prove that I had purpose and meaning to be at those tables and those meetings. I needed to have credentials behind my name and thus set my drive to become a social worker. And similar to the time of graduation, it became a law in the state of Michigan that you had to become licensed and that pretty much you couldn't do anything with a BSW. And so going to grad school was going to be my only way to become self-sufficient. So I set out to apply to all 4 major universities and was accepted to the University of Michigan School of Social Work in 2007. I graduated with my degree in children, youth, and families and a school certificate. Um, and that has allowed me to um, be an efficient advocate for people and families with disabilities. In my spare time, I enjoy the outdoors. I've completed the Detroit Free Press Marathon 3 times on my hand cycle. I uh, played floor hockey, I kayak, and I also like to put my chair on in nature and, freak people out on how fast I can go down bumps and jumps. I have a variety of friends with and without disabilities. I competed in Miss Wheelchair 2004 and was third runner up. Um, and that's pretty much me in a nutshell. I just want to let everybody know on the board and any parents who may be listening to this is um, always have expectations for your child. I think that that was the greatest tool that my mom ever gave me. She was never certain what I was capable of, but she always had expectations. Once I accomplished that expectation, I strived for the next one. Thanks for your time and have a great night.
Thank you so much for your story. And I think, Hannah, I think you're on a different laptop now.
Yes, I
Want to
am.
try it on? And sound works. Okay. Floor is yours.
Yay! So, do I start now?
Yes.
All right. Hi, I'm Hannah, and I have high functioning autism and some anxiety. So, um, so I started my own, well, I started going to a local art studio to reduce anxiety, and little did I know my art would turn into a business, and I started making things and people started asking if they could buy them, and then so after multiple times, so I just thought maybe I'd try having a business, and it's been very successful, and anyone with special needs can do what they put their heart to. So yeah, it's just been, yeah, been play God's really been faithful, and he's really helped me overcome my challenges, and yeah, it's just great to be able to encourage other people and be a voice. So thank you everybody for your time, and I hope you have a great night.
Thank you so much. Any questions or comments by any of the board members? Well, yes, John Paul.
Yeah, I just wanted to comment. how impressive the two of you are and your achievements, and Hannah doing your passion and following through with that. And I think just the both of you hearing the stories of what you can achieve, and even in the face of adversity of obstacles that are put before you, to go on into higher education, to go on to pursue your interest is a great story. I love the advice about setting expectations for your children as a parent. I wholeheartly believe that, and there's no limits as to what either the two of you can achieve, or any of the people out there who put their mind to it. So it is two stories that inspire hope. So thank you for being here and reminding of us of that tonight. Thank you.
Dennis?
Thank you.
Hannah, thank you for your excellent presentation. I know that part of any business is sales, so can you tell us a little bit more about what you create, and how do we get a hold of you? Do you have a website?
I have Instagram and Facebook, and it's called Hannah Joy Spectrum Designs. You can just look me up. It's a public page, and I wire wrap glass beads around silverware, serving utensils, and then I make wind chimes with beads, and I also have these wine platters. They're wine bottles that are molded into little platters for like cheese and crackers.
And last year you sold.
And last year I sold.
Had 18,000.
I had 18,000 in sales.
Yeah.
Oh, thank you, Zach, for posting that.
Well, thank you very much for that information. It sounds like you got a growing business, and I'm sure you're going to have some other wonderful creations for us in 2022. Thank you very much.
Thank you.
Yvette?
I would also like to thank both of you for sharing your story, and you, Cheryl, for not allowing others to set limitations on what you could or could not do. And Hannah, your story is a great inspiration to others who are thinking about starting their own businesses. So good luck to both of you as you continue to advocate for others.
Thank you. I'm actually in 4 stores.
All right.
Okay. Other board comments? Not seeing anything. I would like to say something. First of all, Hannah, I think it's amazing that you're making money in the world of art.
Thank you.
Because you're the first person I met that actually does that, and they're alive. And I think those that make money are long past their agents. So that's pretty amazing, just in itself. It's a tough business to be in. You're welcome. And Cheryl, all I can say is, go blue.
Oh.
Yes,
So,
go blue.
It's great to hear you in your pursuit for higher education. And yes, in some places, they don't want to know who you are. It's what shingle you have. So I think it's also awesome that you subscribe to having and achieving those expectations. So again, thank you both for being on here. Again, my favorite part of our general board meetings.
You're welcome. Thank you.
Yeah, thank you. Thank you for having
us.
Okay, thank you. Next on the agenda is our financials. Anya, welcome back.
Somehow it seems just a little cruel to put the finance person after the stories that inspire hope and all of your favorite part, and now I come up here. Okay, so we're looking at February financials. What you're looking at here is revenue for the month of February. The vertical lines are the current fiscal year, and the horizontal line is last fiscal year. So you can see that revenue is still up considerably from last fiscal year. I do expect that to continue at minimum through the end of the emergency order. We did finally get the rate certification letters from the department that has the remaining 23 cents of the direct care wage money in it. So you will see that. I believe we're supposed to start getting that in April and then each month after that. So that will pick up a little bit revenue just because we have not received that through year to date. So it will spike revenue just a little bit. We have been pushing that out all year, so just kind of going to even things out compared to what we had been pushing out. Next slide, please. So all of that revenue is primarily due to the eligibles. So we've talked about before that eligibles are up and continue to go up primarily because of that emergency order where makes it so people do not come off of Medicaid and or Healthy Michigan. The other piece is there are no spend downs during this time period. So anyone that would typically have a deductible amount that we would pay out of general fund to become eligible for Medicaid, they're automatically Medicaid eligible on the first day of the month during the emergency order. So again, we'll expect this to continue to go up until that emergency order changes, and then we'll start to see it flatten out and then potentially trend down. Next slide, please. Okay, so this is assets, and this is compared to the end of September to February. So you can see that the end of September we were at about almost 73 million, and currently as of February we are at about 91. You can see our receivables are down a bit. Other assets are roughly the same, and capital assets continue to depreciate over each month. Next slide. Looking at liabilities, again, this is compared September to February, so you can see our liabilities at the end of the year are typically higher. Now that we've paid some of those down, you can see that's gone down a bit. Due to state is roughly the same. Employee payables and long-term debt, again, not much different. So then now you are looking at the statement of net position, and so this is a year-over-year comparison. So this is looking at where we were that last fiscal year at this time. So you can see our total assets are up slightly. That says 162 versus the 159, almost 160. Our liabilities are slightly down, so that means our net position has gone up compared to last fiscal year at this time. So this is looking at revenue, same time period, last fiscal year to this fiscal year. So you can again see that is up. State General Fund, I believe still here shows even, but we do have a slight adjustment you'll see next month in Budget Amendment 2. County funds is the same, and then all other revenue is just slightly lower, and that's related to grants. So then the expense comparison from last fiscal year to this, you can see administration is slightly up, but what you can see the significant difference in is the provider network expenses. And so that we totally expect, because not only did we adjust some of the master's level clinician salaries, but we also pushed out that increase in the direct care wage funding to $15 minimum. And so we would expect this to go up compared to last fiscal year. You can see grants is roughly the same, and all other is not much different either. So then we're looking at net income again, compared last fiscal year to this fiscal year. Revenue, you can see, is up just slightly. Expenses are up. So what that means is net income is actually down slightly. Again, all planned, all predicted. So again, we'll see that continue throughout the rest of the year, and then, like I mentioned, a little spike related to that remainder of the direct care wage adjustment. So what you're looking at here is the top 15 providers paid this month and the amounts that they were paid. And with that, I will take any questions.
Board questions? I have a couple.
Okay.
And yes, still, Stories that Inspire are my favorite. But I do like the numbers. All right, so you mentioned that the 23 cents is direct care wage. So we're finally getting that from the state. Prior to this, were we pulling this out of our reserves then, essentially?
Sort of. Because we do have excess funds in this fiscal year, it wasn't really coming out of our reserves. It sort of came out of that excess funds, and now we'll kind of catch up on that through the rest of the year, because we chose to go ahead and push it out and not wait for the actual cash.
Okay, and I think this, at least for me, the first time I heard that under the emergency rule notes that there are no spend downs, which is really nice. I wish that could be permanent.
Yeah, that would be nice.
Yeah. So, but basically, this is, the emergency order runs till October 1st?
You know, I keep hearing different things. I thought I heard the end of the calendar year, and then I heard the end of the fiscal year, and then, so honestly, I don't actually know, to people, like, I suspect, we're gonna get a few months after it actually runs out before we even start to see a change. But I believe Dana's shaking her head that it's the end of September, is that what you said? Yes.
Yeah, end of the fiscal year. So that would mean then the number of people that are currently eligible for Medicaid, which drives our per member per month, they're going to start declining. So then even if the rate doesn't drop, we'll get less revenue just because of that.
So they can drop it, doesn't it? I mean, in all actuality, they probably will. However, if at one point they were eligible, they could remain eligible and hopefully will remain eligible and have their redetermination done to continue to keep them on Medicaid.
Because they have to do redetermination, once a year?
Every year, yep.
So if they do one just before that and they're still good,
yep,
then they won't fall off. Okay. That's all I had on that. Anyone else with questions? All right. Thank you so much.
Thank you.
No budget amendments.
So you'll get a budget amendment we decided to do it in May because we should have all of this collected and some of the newer things going on. We want to make sure we're representing those appropriately with CCBHC and those types of things. So we decided to wait till May to give you a more accurate reflection of where we expect to be by the end of the year.
Okay.
Okay.
Thanks. All right. Next on the agenda are board exec or various board reports. So I'll read mine. This is my board report for April 2022. This month, the executive committee met on Wednesday, April 6th at 4 p.m. In attendance was our vice chair, Ms. Bernard, secretary. Wait, I don't think she was there because she was no longer. Our secretary, Mr. Furman, chairs of the business ops and policy, Ms. Navy Dyer and Ms. Newman, along with our executive director, Ms. Lazenby, along with some of the leadership team. The April agenda for last week's committee of the whole, tonight's general board meeting, and next week's 5 p.m. Next week, Thursday, is the 28th, 5 p.m. study session. We're all confirmed. The CEO evaluation time was presented to us by our director of HR, Edna White. The executive director performance review committee will meet at prior to our upcoming board meeting. We did meet this evening prior to this meeting. And then topics. One other thing that I want to report on was CMHA. So that's our association. So there is a CMHA summer conference. It's in Traverse City, Monday through Wednesday, June 6th through 8th. Note, again, that's a Monday through Wednesday. Normally they start on a Sunday. So we're going to need to start letting Sheila know if you plan on attending. There may also be an item on the agenda tonight for that. Also, the CMHA Metro meeting hosted by Detroit Wayne was scheduled for May 26th, but that's also a night that we have study session. That's a Thursday. So they've now moved that to Thursday, June 9th. So that follows the CMHA summer conference that's in Traverse City, Monday, June 6th through the 8th. I know I just said that. But I'm just repeating it just so hopefully more of you will think about joining us at that conference. Also a reminder, think about the PAC, the Political Action Committee, which is a taxable donation, not a non-taxable, but a taxable donation. And either to go to their website at cmham.org, look at public policy and look at their CMH PAC to make a donation, or send them a check, making it out to CMH PAC, sending it to their address on 426 South Walnut, Lansing. Or, like I said, go online. I went online this weekend and made my donation. Last alternative is to bring the check in here. We collect them and we can send them in as a group as well. Typically, in a given year, from a board perspective, nearly 100% of us, usually 100% of us, contribute to the Political Action Committee, especially important in an election year. And then last is advocacy. As of this writing, well, actually, as of the writing of this report, which I did on Sunday, the two bills that Senator Shirkey has sponsored have still not yet been voted on, which is great. That means he doesn't have enough votes This is because of all of you and others continue to make the phone calls to remind senators voting for that is a bad thing, and to support our public solution. So continue to call them, reach out, and perhaps we can flatten 597 and 598. As well, at our meeting, our CEO, Executive Director Dana Lazenby, gave us an update. Our CLO, Chief Legal Officer Kalana Ali, gave us an update about a class action lawsuit that we plan to join as it relates to overbilling by the Great Lakes Water Authority. And then, as well, our Chief Compliance Officer, Bernard Hooper, gave us a briefing on our board's progress to complete the required trainings. As of that meeting, 3 of the board members still had to complete their compulsory training. This does not include our 3 new board members. So, again, I would ask that you guys do that to help us in case we get audited. There was no public comment at either the start or the end of the executive meeting, and we adjourned upon completion of our agenda. Before I put this down, I also got a letter from the CMHA folks, and to let you know that at our last Metro meeting, Angelo Glenn, he's the chair of the Detroit Wayne Integrated Network, so he's my counterpart at their board. He has been nominated to the slate of state officers, so we'll want to go to that conference and lend support to make sure that he gets voted in. So just wanted to bring that up. So another reason to attend that conference and be a delegate. All right, that concludes my report. Next on the agenda would be business ops. Ms. Namie Dyer.
Hello. I don't have much to report on. We met at the Committee of the Whole meeting on April 11th, and the only item that we had was that there was a vacancy on the Business Ops Committee, which has now been filled by Mr. Young. And we had the financial review today since Anya was out at the conference last time. Thank you.
Next would be our Policy Management Committee Chair report. Since Ms. Newman's not here, were you going to report on her behalf as to what was covered at Committee of the Whole? Okay.
So I don't have detailed notes, but during policy management, Ms. Marquita Massey had presented a few quarterly updates along with Jillian Trumbull. Ms. Massey had reported on the quality management team update. She went over the quarterly report during that time period, and there was a packet that was included in Boardable for reference. And then she also gave us a corporate compliance update. And then Ms. Trumbull had given us a provider network team update in which she discussed some of the additional providers that were added to our network. And she gave us a quarterly report as well. And I believe that was it for policy management.
All right, thank you very much. So the next item on our agenda is to fill our opening for vice chair. So yes, we have a full board at this point, but Hadass had stepped away and stepped down and was replaced. And so now we have a vacancy for our officers. While I'm still chair and we still have Secretary Adam Furman, we need to look for a nomination for board vice chair. So is there anyone who would like to make a nomination for either for themselves, self-nominate, or nominate someone else for vice board chair?
I'd be interested in nominating myself. I'd like to take on the responsibility if you'd have me.
Okay. Is there a second in his nomination?
This is Sarah. I second. Oh.
Okay, thank you. Is there anyone else who wishes to be considered for board vice chair? Not seeing anyone. I would say that we don't need to vote, but a vote of acclamation for you to welcome you as our board vice chair through into our October meeting. So congratulations.
Thank you.
Okay, next item on the agenda should be the RAC recommendations, and that will be presented by our director, Vicki Suter.
Good evening. I'm Vicki Suter, Director of Rights and Advocacy. I have 3 items that I need action from the board this evening. Our first item would be a reappointment of a current Rrac committee member, and that would be Lois Schulman. Lois will be completing her first 3-year term. At our in our April Rrac meeting, we did unanimously vote to recommend that she be appointed to a second term, and so we would need a vote on that this evening for her.
Do we want to cover all 3 on one motion,
sure.
or go
I'm
for
okay with
one
that.
for 3? What would be the board's perspective? All for one, or one for each? Okay, I'm seeing heads nod, so let's keep going for all 3.
So just
So
you know,
that,
Lois
Betty?
is a good standing member. She's very participatory in the meetings and a valued member of our Rrac committee. The second would be, we do have currently 3 vacancies, but we did interview 2 individuals for those vacancies. We just recently had a new vacancy, so we will be working to fill that. But the board, the Rrac committee did interview 2 individuals, Philip Hussey and Betty Ruas. Philip is an individual that we feel would be a good contributor to our committee. He currently is the vice chair of the Training and Treatment Innovation CAC Advisory Committee. He has experiences and ability to voice his opinion that we think will be an asset to our Rrac committee. Betty Ruas is a past member of the Rrac committee. She did serve 2 terms. Based on our policy, an individual can serve a 3rd term after they've been off the Rrac committee for 6 months. She has been off the committee for at least a year. She has applied to be considered for her 3rd and final term. But she was a great member of the Rrac committee. We'd be happy to have her back. So those are our 2 individuals to be appointed to the Rrac committee. Our 3rd action would be related to our appeals committee. One of our appeals our appeals committee policy states that 3 members of the Rrac need to be part of our appeals committee. One of those members has chosen not to seek a second term on the Rrac, and so that leaves us a vacancy of one of the Rrac members on our appeals committee. We did discuss this at our April Rrac meeting, and it was the decision of the Rrac members that we would recommend Judy Summers to be included as part of our appeals committee. For a number of years, Judy participated on our appeals committee as a board member. She brings great insight and questions and thoroughness to that committee when she was on it, and it would be a pleasure to have her reappointed to that appeals committee as a Rrac member.
Thank you so much for the recommendations. Christina, you're on the RRAC as liaison. Do you want to make a motion to renew Lois, add Betty and Philip, and add Judy to the appeals board?
I would love to make that motion.
All right, thank you. Is there a second?
I'll second, John Paul.
All right, thank you, John Paul. Is there any discussion?
I'll just make a comment
Sure.
that, I think all the candidates are extremely qualified. I've had the pleasure of working with Lois years ago when she was a board member, and she's always just been an advocate, and also, just seeing the work that she's doing, it's great now that she's not on the board, still contributing. And just reading through these applications and Betty Ross and looking at impressive credentialing, civil rights advocate in the 1960s in Georgia. I mean, that's pretty amazing. Love to hear those stories. But you can see why she wants to be on this committee as far as being an advocate. So an impressive group that we have, and so it's great for our organization.
Thank you. Other board member comments? Yep. So like John Paul, I have worked with Lois on our board and Judy on our board, and on the RRAC with Betty. And if no one said it, she's an author, and her book is for sale if you're interested in buying it. So, and see see Vicki later to find out where you can get the book. I'm just kidding. Anyhow, so at this point, let's have a vote to, I guess, a roll call vote to approve the motion to include Lois, Betty, Philip, and Judy Summers to the respective renewal appointments and appointment to Appeals Committee.
All right, Mr. Young? Yes. Mr. Furman?
Yes.
Dr. Hahn? Yes. Mr. Landsman?
Yes.
Ms. Mamie Dyer?
Yes.
Mr. Cohen? Yes. Ms. Root? Ms. May? Yes. Ms. Woodruff?
Yes.
Mr. Therese?
Yes.
Right, so the motion carries.
Thank you.
All right, thank you. All right. Next on the agenda is the May month, or the May Proclamation for Mental Health. Christina, would you like to take this one? I'm sorry, Christine.
You are allowed to call me Christina.
Thank you.
Good evening, Board. A few years ago, the Board made a request that in recognizing May as Mental Health Awareness Month, that we bring the proclamation forward in April so that it would be more timely for the Board and for our communities. We have started sharing the information with our local townships. I know John Paul had asked a few years ago now, I guess, that we also share the proclamation with school boards. We are starting to receive information. Our Chief Compliance and DEI Officer, Bernard Hooper, will be presenting the proclamation in Farmington Hills, and then we also received a request for Avondale. We will receive the requests throughout May. Generally, we get about 20 requests for appearances, and then in other situations, the people will just mail the proclamations to us. Also, I know last year Jonathan had asked about having the board sign the document. We use DocuSign, I believe, so we'll coordinate that with Sheila again. I can read it, or you can read it, Jonathan, if you'd like. I know you wanted to last year, I believe, but...
I think you do a better job of reading through it since I think you drafted it.
Whereas mental health is important for our individual well-being and vitality, as well as that of our families, communities, and businesses. And whereas the COVID-19 pandemic has been a reminder of the importance of integrating mental health into preparedness and response plans for public health emergencies. And whereas younger adults, racial, ethnic minorities, essential workers, and adult caregivers reported having disproportionately worse mental health outcomes, increased substance use, and elevated suicidal ideation associated with COVID-19. And whereas 1 in 6 U.S. children aged 6 through 17 years had a diagnosed mental health, behavioral, or developmental disorder. And whereas May 5th, 2022 is designated the National Children's Mental Health Awareness Day, and May 1 through May 7, 2022 is designated as Children's Mental Health Awareness Week. And whereas Oakland Community Health Network is committed to being a zero suicide organization and cultivate a network of providers who are engaged in the zero suicide philosophy. And whereas mental illness is a biologically based brain disorder that cannot be overcome through willpower and is not related to a defect in a person's character or intelligence. And whereas mental health recovery not only benefits individuals with mental health disorders by focusing on their abilities to live, work, learn, and fully participate and contribute to our society, but also enriches the culture of our community life. And whereas the Oakland Community Health Network and its service provider agencies are committed to inspiring hope, empowering people, and strengthening communities. Now, therefore, be it resolved that Oakland Community Health Network hereby recognizes May 2022 as Mental Health Awareness Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, and schools to recommit our state to increasing awareness and understanding of mental illness and the need for appropriate and accessible services for all people with mental illnesses to promote recovery. And this is an action item for the board.
All right, thank you. So I would look for a motion to approve this proclamation.
So moved. Adam?
Thank you, Adam. Is there a second? Thank you, John Paul.
John Paul.
Is there any discussion? I would say you do read it better than I do. So thank you, Christine. All right. Hearing no discussion, we'll do a vote. Almost every time it's a roll call.
All right, Mr. Therese? Ms. Woodruff?
Yes.
Ms. May? Ms. Root?
Yes.
Mr. Cowan?
Yes.
Ms. Mamie Dyer?
Yes.
Mr. Landsman?
Yes.
Dr. Hahn? Yes. Mr. Furman?
Yes.
Mr. Young?
Yes.
So the motion carries. Thank you. All right. Next on the agenda should be our consent agenda. So I'm looking for a motion to approve the consent agenda, which includes the board minutes from last month, the month of March, along with meeting minutes from the RAC, Committee of the Whole, and CAC, Citizens Advisory Committee. Is there such a motion?
I'll move approval of the consent agenda and the various minutes that have been presented for our consideration.
Thank you very much.
And I'll
Mr.
second.
Thank you, Mr. Torres. Since it's consent agenda, there is no discussion. We just vote on it. Roll call. Here we go.
All right. Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hahn? Yes. Mr. Landsman?
Yes.
Ms. Mamie Dyer?
Yes.
Mr. Cohen?
Yes.
Ms. Root?
Yes.
Ms. May?
Yes.
Ms. Woodruff?
Yes.
Mr. Therese?
Yes.
Okay, so the motion carries. Thank you. Next on the item on the agenda should be the PAC. It is. Okay. So earlier this evening during my report, I talked about the CMHA, the Community Mental Health Association of Michigan's Political Action Committee. So, like I said, it is a taxable, not a or a tax deductible item, but it is a taxable item. We provide money to this Political Action Committee. They meet with various legislative folks, hoping to help them with their reelection, and to help focus on mental health, developmentally disabled, substance use, and kids with severe emotional disturbance, along with a dozen other things that we do as part of an association and what we do as part of Oakland Community Health Network. So, next slide. Again, I hope that you guys would consider supporting it. It will help those legislators. It won't be a lot. It will be very little compared to the folks that donate for things like Meridian Health. But for whatever reason, our dollars seem to stretch just like we do when we operate our organization, and we do a better job than they ever will be with a private solution and our public solution. Our PAC's money seems to go a lot further than their money. So, again, another reason to support the PAC. Then lastly, as I said earlier, you can write a check, mail it in, bring it in here, or go online. So, and, why support the PAC? There are going to be new legislators due to term limits. Few of them understand what we do, but what they do understand is we help folks that are voters, that are constituents. So we help them understand what behavioral health and what services we provide. And as I said earlier, our PAC money goes a lot further than like Meridian Health's money goes. So we still need to have that Political Action Committee funding to promote our messaging to the legislators. Okay. And again, write a check, bring it in, mail it, go online. Again, it can't be a corporate check. It has to be out of your private pocket. That's why Oakland itself can't write one, but a lot of the staff contribute as well as a number of the providers and advocates. So I would urge you guys to contribute if you can. Thank you. Another item from my earlier report. So if it sounds like a broken record, for those of you that know what a broken record is, so the summer conference is Monday afternoon, June 6th to June 8th. There'll be a delegates meeting on Monday afternoon for voting. On Wednesday morning, there will be a Metro meeting, and there's a lot of workshops and breakout sessions, things for education, things for knowledge expansion, things to work on your board works. All that happens at these conferences. So think about attending. It's up in Traverse City. It's very lovely. And I welcome you to attend. So if you're interested, let Sheila know that you plan on attending. If you'd like more information about it, certainly go to the CMHA website to see what's going on with it, or ask any of us that have been on the board a little bit longer than you have. And we'll tell you, well, you've already heard why I go. So thank you. Committee reports. So we'll start with the bylaws. John Paul.
We had our last bylaws committee meeting on April 6th. At that time, we discussed or debriefed on the study session from March. We made it up to Section 501D as a board in that study session. So we discussed the changes that were suggested. And you see that in your packet tonight that you have in this folder would be reflective of the changes that were made up to Section 501D that are reflective of the board. So that's the most updated copy that you're going to look at when you prepare for the next study session for this month, for April. Also included in that packet and what we had requested to be given today would be the most up-to-date version of the board policies. So that's reflective of what the committee has put forth with including all of our recommendations. One copy is the clean version, which is the document in its entirety, and then the other one is the red line version, which has the original, and then included is the red line, are all the changes that the committee is recommending. So we asked that you review those as well for our next study session. So at that study session, we're going to ask, what we discussed at the meeting was we were going to ask for the changes from the last study session to be accepted. Then we will certainly proceed with going back, if individuals would like, to re-look at some of the language, and then we'd like to move along from 501D through the rest of the bylaws. Looking at it, and what we talked about in our meeting was that the likelihood that we'll make it through all the bylaws and then through the policies in that meeting is not high. So what we do hope is that we're able to make it through the policies in its entirety, and we will at that time be looking forward and asking the board to potentially set some special meeting dates out for the month of May and June, because the May, June, and July study session agendas are already quite full. And the intention as a committee that we are recommending that is that we want to keep moving this along so that we can have a process to it, and so that we can finish all of this work we've been working on in the last year in its entirety, and hopefully be able to wrap it up with a consensus of the board, and then take all of the final recommendations for a full board vote at some point in the near future. So that is what we discussed at our meeting on April 6th. Thank you.
Thank you. Ms. Root, recipient rights report.
Thank you. Our meeting was held Thursday, April 7th here in Troy. A few highlights include that we voted for the chair and vice chair of the committee, which were the two reappointments of Nancy and Liz, so congratulations to them both. We also had a discussion about our third goal for this year, which is reflecting on how stigma affects a person when engaging in the rights system. And then Vicki Suter presented a site visit report, and it was stated that about 35% of sites have been visited up to this point. And then as you learned today, we also voted on recommendations to this board of a member's reappointment on the committee, 2 new candidates for consideration, and a member's appointment to the appeals committee. So thank you, Vicki, for presenting that information to us and for requesting approval for the recommendations of these passionate folks. Our next meeting is scheduled for May 5th.
All right, thank you. And then for Citizens Advisory Committee.
Yes, I was unfortunately only able to attend just the beginning of the meeting, and during that time, it was held on April 16th at 9:30. During the time that I was present, they did review an application for a new member at large, Zach Cardinale, and he introduced himself. After that, I wasn't able to attend the rest, but I do know that during that time, that meeting, they reviewed strategic initiatives, which was presented by Frances Carley, who's the Deputy Director of Strategic Initiatives here at OCHN. And then Charlotte Rowe had provided a credentialing update for different providers, and they did re-credential one provider. It was the Neighborhood Service Organization during that time. And then Christine gave her usual communications report during that meeting. But the meeting minutes are available for review as well. And our next meeting is actually tomorrow at 9:30.
All right, thank you. Dennis, there wasn't
No, we're meeting a week from Wednesday.
and that's for the Substance Use Oversight Policy Board meeting. All right, next item on the agenda is the Director's Report. So Dana, you have the floor.
Thank you. And again, I want to welcome our new board members, and I think this is the first time you've heard me give my report. So please let me know if you have any questions. I'll try not to speak in a lot of letters. I know we didn't do that. But I wanted to start off by saying how important it is to have people complete our annual needs assessment. It is out there. I believe today is the last day for the completion of our annual needs assessment. So if anybody has not done that, please fill out that survey. Also, we did recognize April as Autism and Alcohol Awareness Month. So as always, we sent out press releases and social media to inform the community about these important observances. In response and sort of in informing the community, and it relates to the public comment we had earlier, OCHN hosted a crisis intervention training team, and that training actually is from CIT International, and the pilot class included 15 law enforcement officers from Royal Oak, Birmingham, Bloomfield, Auburn Hills, and Southfield Police Departments. And if most of you may be aware, but some may not, CIT is a 40-hour-a-week training that is offered to law enforcement to help them learn how to approach, assist, and de-escalate crisis situations. So since we started the CIT training, we have actually trained over 900 or almost 900 law enforcement officers since 2015. So I wanted to reflect a little bit on the major tragedy that occurred in Grand Rapids a few weeks ago, where a young black man was fatally shot by a law enforcement officer. And it really does reinforce the importance of our training and also our involvement with the community when tragedies occur. So we don't know all the details of what happened, but the emotional fallout of the graphic images that were released really do call for our need to be available for this community, for our community, to help individuals really process what has happened in this situation. So it's so important that we continue to educate the community, talk about how, when, and where to get help when needed. And then we continue to talk about educating the community on OCHN and the services that are available, the crisis services, and all of those programs that are available through our provider network. The other thing I want to talk about, just briefly, we actually, the chief leadership team and myself went to a conference last week in D.C. or Maryland, and the conference is NatCon, which is a National Behavioral Health Conference, And so the focus really does align with our strategic priorities and the things that we're trying to improve within our own system, and that is focusing more on SUD services and the needs for SUD services to be integrated. Crisis services for all populations, and they specifically had one that addressed individuals who are on the spectrum. So that was really important to see what the special needs of different groups and what is required when we provide our CIT training to make sure that we cover those special needs of particular people are dealing with. Also, CCBHCs, which is the Certified Behavioral Health Clinics, continues to be a hot topic at this conference, and as it has been for the last few years. And one of the things that was really unique and different this year, there was a lot of focus on diversity, equity, and inclusion. So we hope that that continues. The conversations were very enlightening. There are a lot of people there this year. So last year it was virtual, this year it was in person. So it was good to engage with people and talk to your peers and other stakeholders about what's going on across the country. So the other thing I just want to follow up with very, very quickly, and just for the benefit for our newer board members, is that the OCHN strategic priorities that we continue to focus and work on, but also looking at our annual needs assessment and how we integrate what the community says is needed and what we see in terms of requests for services. So with that, I wanted to talk about, just briefly, our strategic priorities are to enhance and expand access to non-emergent services. And we want to make sure that we fill gaps so that the continuum of care is available, so people don't automatically think it's either outpatient services or going to a hospital, ED, or a crisis center. We also want to improve our crisis services. So with that, last year we did receive a grant to expand our crisis services for children, and our mobile crisis teams are in place for youth. And we also continue to work on construction at the Resource and Crisis Center in Pontiac, also where our crisis vendor Common Ground is located as well. Integrated behavioral health care, expanding that through our behavioral health homes, our, like I said earlier, certified community behavioral health clinics, and our complex care coordination for those individuals who are not assigned to a Medicaid health plan, but they do have Medicaid. We really need to focus on improving the system of care for children, and it's really great to see how the state has, reorganized a bit to make sure that children are the focus of services and that full system of care is available to those families. The other big thing is provider relationships and value-based outcomes, and really making sure that we're improving our involvement with our providers, which is so critical to what we do. We have to work together, but also looking for those important outcomes. Finally, which is really the biggest thing I have to say, and this is really how we do all these other things, is our workforce development and really looking at ways to recruit and retain those critical staff, direct service professionals, direct care workers, and licensed clinicians. I don't think there's any provider in the state or even across the country that is not struggling to hire clinicians and direct care workers, which we are very critical, especially if you look at who did the work during the pandemic. Our direct care workers stayed in place. So we have to celebrate them, but we also have to make sure that we can recruit, train, and retain those good workers in our system. So I know in previous meetings, Jonathan, our board chair, asked for some more details about the persons served. So I won't go into a lot of detail, but I did provide that data. So if there's any questions about that, please don't hesitate to ask. With our Oxford response update, we are getting recognition and communication from the state, which is great, but we really want to focus in more on what we can do for that community. We're hearing a lot about the access issues and the time it takes to get family and students and administrators into seeing or addressing their mental health needs. And it's just a reflection of the struggles we're having across the system because of the workforce, and being able to identify those services and supports for families and hoping we can tighten that timeline so that the day that they ask for services and supports, we can get those services and supports in place as quickly as possible. So I hope you all have been made aware, I think I did, hopefully made you aware of this, the Oxford Mental Health Benefit, which is a benefit for families in Oxford, the students, the administrators, and the teachers. And it's a benefit that was approved by the Board of Commissioners to ensure that families did not have barriers to accessing care because of co-pays and deductibles. And so that program was started in March, and as of today, we had 78 families or individuals request for payment or reimbursement for those services. So they actually provided a receipt to show that they paid, and we were able to validate and verify and pay that, or they gave us their bill, and we took care of those bills. So 78 people for maybe 3 weeks in place, and we're hoping to spread the word so we'll have more families that'll come and reach out to this program and receive that payment so that they can continue to receive those services. So with that, I'll stop and see if there are any questions.
Thank you. I just want to say thank you for providing the additional stats.
Sure.
And that's important for both board members and those in the public when you're talking to the legislature, whether that's House of Representatives or that's the state senators, and they want to know what do we do, and what do our providers do. Mm-hmm. These stats will help us communicate what we do and to what extent we do in terms of helping those in our communities. So different things, you don't have to always tell them all the different things, but every time you call, you can give them a different stat about, did you know we do this? Did you know that we provide, 1,700 services to youth this year? Did you know that we, through MORC and Easter Seals supported almost 3,000 people? So use the stats, help the advocacy effort to keep us and the public option. Thank you. Are there other questions or comments for Dana? Yes, Ms. Root.
Thank you. So I wanted to voice some concerns because I am a clinical social worker in the community, and I have been hearing different things about Common Ground in New Oakland. I think that there's a lot of confusion about the changes that are coming up, and even for myself, I think it's concerning that I'm on the board here at OCHN and, meeting with children and adults, and I'm not sure, if I'm going to have to start providing a new phone number for crisis support for youth. And I have heard that a fellow social worker told me they recently called Common Ground because they did have a youth who was experiencing suicidal ideation, and Common Ground told them that they're no longer serving youth, that it was New Oakland. And I didn't think that the change was official yet, so I just wanted to say that I'm concerned because, people need to know what's going on, right? We can't, a crisis happens at any moment, so I'd like to ask, can we have some type of presentation here for us? And then I want to know what we're doing to make sure everyone is educated about the changes in the community.
Ms. Ruth, thank you for bringing that to our attention. We absolutely want to hear about those situations like that because that is very important. Our numbers are posted, and we also, that crisis line, no one should ever be turned away from that crisis line. And so those are things we definitely want to hear about immediately. So Kim, if you want to add to that, but we can definitely provide a presentation. And if you notice, we're making more commercials and things of that nature. So we want to make sure that people know how and when to connect with us, and especially our providers who are providing those resources for people that they are not going to be able to reach after hours. We also have extended our access hours to make sure that if people aren't in crisis and they just have an urgent or a routine need, there's more available time that people can have those questions and situations addressed. So Kim, I know you're...
Can I add two more things? Just thank you. So another thing I heard was that New Oakland said that they're not providing in-person services. What I'm aware of right now is that for Common Ground, if you have a crisis, you can call or go to the center. So I wanted to know if that's true, if New Oakland is trying to mostly serve through the phone. And then there was one more thing. I just wanted to ask when our construction
when we're expecting it to be completed, because I couldn't remember that date. Thank you.
So you ask a lot of questions there. So let's see if I can answer some of them for you. It's Kim Flowers, Chief Clinical Officer. So first, as Ms. Lazenby explained, there are two different processes for New Oakland and for Common Ground. And I think you asked, had we explained that information and sent that out? Yes, we did communicate that information to our hospitals and other partners. But with any change, it takes a little bit of time to get acclimated to who to call for what. But as she also explained, there should never be we don't do that and we don't know. So we will follow up and understand. Common Ground is well aware of the information of how to connect someone with New Oakland. Now, in brief, for children who walk into Common Ground, those children are managed by Common Ground. So if a child, parent, family walk into Common Ground, then Common Ground will assess and evaluate for supports and needed services. If that child is found in the hospital, so a parent or some emergency has sent the child to the hospital, then the hospital has information to call New Oakland. Now, should they get confused and call Common Ground, they too have a way to get to New Oakland immediately. We do share this information also in our hospital liaison meeting. Just so you know, there is a hospital liaison meeting every month with our community partners, hospital partners, in the emergency rooms and such places in the hospital, and our providers are there too if they need be. And we share that information again there monthly. So that information is provided. So we've sent out information, and we also reiterate that every month. I would like to know where you were and who didn't know, that information, so that we can be sure that they do know that. Now, I hear you also ask that you'd like to have a presentation. In fact, I believe it's next month. Kyle, who is our Director of Crisis, will be providing a report. So we can have him take some time, if that's okay with the board, to share some of that information as well. There was something else that I missed? So New Oakland right now, they do much telephonic review. However, they have the capacity to go and meet the person in the facility as necessary. So the evaluation may be initially, because it's coming from the hospital to the clinician, they will do that evaluation telephonically, and if they can't find the additional information needed and it's necessary to do a face-to-face, that can happen as well. Honestly, yes. A lot of times it's mostly due to that. But our hope and what we envision is that those evaluations would be in person. And then, we're trying to get our construction. That's what you asked about construction. I believe, I want to say May 2nd was the last day I saw that construction will actually start at the RCC, or Resource and Crisis Center. And I believe I saw a date mid-July to August for completion. You're quite welcome. Anything else?
If I could, I want to make sure that you have that information before you leave today, so that you can share it and we can do another communication blast to make sure people have accurate information that reflects what Kim and I have said.
Mr. Cowan?
Yeah, Dana, just catching the news, there seem to be a number of opioid settlements going on with individual communities. So my question is, I can't imagine that, unless it's a very large community, that they have a setup. I know there's guidelines for the money. And by the way, full disclosure, I'm not involved in any of this, and neither is my law firm. So this is purely from our perspective. So what is happening? Is there any interplay with our organization and some of these communities? Because, for instance, I don't see communities setting up their own network. There's not enough money, number one, but also just the vetting of anybody they wanted to hire and all these practical things that we already do. So could you just briefly let us know how that money's going to communities? They have to spend it within guidelines, but is there any interplay with the network?
And I'll pass it to Christy Smiggy, who is our SUD director, but I will tell you that a lot of the money is going directly to the county, and the county is deciding how those funds will be distributed. And so we're working closely with them because we, like you said, we have the programs and the services and the staffing already established. So I cannot see them trying to build a totally separate infrastructure to support where these dollars go. So we're definitely working with them, and I know Christy can add to that because she has been in meetings with those folks.
I really don't have a great deal in addition to that to add. When what the department calls, or what the settlement calls, subdivisions, they have been invited to listen in on webinars from the Michigan Department of Health and Human Services, and we have listened in on some of those as well. And they have provided instructions to the communities that are receiving the funding, and they do point out that they should check with us as the PIHP, because you're absolutely right. Excuse me, because we have the network in place and we are the authority on these issues in the county. It does make sense for them to check with us and try to collaborate, coordinate, cooperate. But we really don't have any control, quite frankly, over what they do in that regard, except for encouraging them to do that.
Okay, so, but we are making, and I do know that there is a county that are getting money, maybe some communities are deciding to contribute that money, but however it works, I just want to make sure that communities know that, who are getting the money, that there's a resource available to them to assist them if they decide to manage it on their own. Because the intent of this money was to reimburse communities and families and individuals for the cost of what occurred to them because of the opiate epidemic. And I just want to make sure, I think all of us do, just as citizens or board members, make sure that money gets used appropriately. Because as we found out with other programs, when there's a lot of money floating around, there's fraud. And I know we work very hard to combat fraud with the money that we get and the money we spend and appropriate. So I just hope that that is a message that gets across these communities, because every time there's a government program, and I'm not beating up on this, but there's people who will abuse it, and they purposefully abuse it. So we have to just make sure that that's maybe a secondary message out there.
You know, just to add to what you're saying, Mr. Cohen, here's the issue is because there are separate communities that are getting this money and very limited information from the state. And so I did hear something yesterday in a meeting with someone from Monroe County, is that Monroe has made a decision, and this is all secondhand, so it wouldn't fly in court, but they made a decision to keep the money and reinvest it in some other fund because they didn't have to use it right away. So I would hope that what we're hearing from our county exec in the state, that they're going to appropriately direct the funds to services for those families and those individuals who are in need. And so we're closely working with them, but there's a lot of unanswered questions, and like you said, there's a lot of money coming to these various communities, and there's no standard way of how it will be distributed. So we want to definitely be a part of the planning of that distribution and how it goes back into services and supports.
Right, but just a point, my understanding, having lived and practiced in municipal law, is that that money will have to come into a community into a special account. It can't be it can't be commingled with the general fund or any other funds. And then that money has to be specifically appropriated in a public meeting with contracts and things of that nature. I just think that that's beyond the scope of many communities, especially smaller communities. So I will leave it up to your good resources and the staff to make sure that message gets across. Thank you very much.
Thank you.
Other questions for Dana? All right, hearing none, we
I had
will move.
I had a question, Jonathan.
Oh, sorry, John Paul.
It's impressive, the crisis intervention team training. I think that's extremely important. I work in probation, worked in both juvenile court, and adult court, and just walking into these situations and having trained officers is key, to de-escalating a situation. I was wondering, though, if there's a difference in the training or if there's a component to it of dealing with adults versus children. Because one of the things that we see more and more of when we see in the juvenile courts is the police interaction with children. And as children, they're more vulnerable. They're in a different situation than adults are. And sometimes, the children's interactions with the adults with adult police officers can lead to other hurdles that they may have in the future, trauma, those kinds of things. And I've seen bad situations, but I've seen great situations, especially in today's day and age where officers that are trained and know how to de-escalate the situation when it comes to children. Is that a component in the training, or do we have something to that effect of how to work specifically, law enforcement, police officers working specifically with kids?
Sorry. Our team actually received the additional training that is for youth, and it is focused on youth, and so that has been incorporated in the CIT training they're doing now, along with those diversity, equity, and inclusion situations and scenarios are being presented, so the officers know how to approach a youth, how to approach somebody who's different than them. So that's the key component of this training, is really looking at how you approach people and meet them where they are. And so, yes, the bottom line, yes, that is incorporated in the training. And our hope is that we can do more. So 15 officers is great, but we would love to do it on more of a regular basis and finding those resources to make sure that we can train as many officers as possible. And in many people in the law enforcement community, not just law enforcement officers, but other law enforcement or criminal justice personnel that encounter people in these situations.
And I agree with that. I mean, the more that we can get, the better. Sometimes what I've seen over the years is that the people that tend to come in and kind of the newer generation are more accepting of those kinds of trainings. And I think it's good because we're seeing more and more of that. And I think it has a lot to do with just the understanding that people have of mental health. And all of the things that fall under that umbrella. So the more that we can get, I think the better, because an officer able to, whether it's an adult situation, and I love the DEI piece, or a situation involving a youth, the better, because I have been on the front lines in both a bad situation and in a situation where it all worked out. And one of the things that we are moving in the probation field is making social workers probation officers. At my last county that I worked in, majority of the probation juvenile staff were MSWs. They had therapy backgrounds. They were licensed therapists, which was great. And it's balancing the two between the therapeutic end and then also the culpability end and retributions and public safety, but also the development piece as well. So giving this training to law enforcement is extremely important, and so I'm glad that we're doing it. And it's great to see 900 since 2015. That's a good number. We'd like to see more, and I think we will probably as time goes on. So thank you for that.
And it sounds like we could provide an update on our justice initiatives for you because of the mental health courts, the SUD courts, our co-responder program. So there's a lot of different avenues we're taking to support people with substance use, intellectual developmental disabilities, and mental illness that encounter law enforcement at every term. So the courts, and like you said, the probation areas and the things of that nature. And even in terms of our crisis and having police officers have the ability to drop people off at common ground, that is not something that happens across the country. So we're unique in that we have that kind of setup.
Thank you.
All right. Other board members with questions or comments? Okay, thank you. Thank you, Dana. All right. This is our second opportunity for public comment. We had people this at the beginning of the meeting with comment. Is there anyone now at the end?
Yes, I believe we do have Zach online who would like to provide public comment this evening.
All right, thank you, Zach. Please.
Hi, good evening. Thanks for the opportunity to chat. So I just have three things I want to cover really quick. The first thing being I want to thank Ms. Lazenby for meeting with the OPA, the Provider Alliance. It's so important to the people served that the board and executive team at OCHN have a good relationship with the providers, and I think from my experience the provider network gets stronger and stronger every single year, and it's just really great to see those connections being made, and some of the commitments being made too about meeting somewhat regularly and visiting different provider agencies. It's really important, so I just want to thank you for that. The other thing I wanted to cover was, I'm just as happy as anybody else not seeing 597 and 598 on the subcommittee agendas. That's really great. But as you pointed out, Mr. Landsman, it's not the time to take our foot off the gas with that. So I just want to make that point. And then follow up to that too, is that I really think a secondary effort that I would like to see OCHN commit to in their materials and social media and things, is the standardization of the DSP as in the occupational code. I think that's ultimately going to be the cure. Well, I shouldn't say cure, but it's going to be help to the providers in their staffing crises. So I think doing that would be very, very important. And again, just the more you talk about it, the more people hear that this is a thing that's happening. And I know that a lot of providers are getting behind this as their secondary kind of advocacy efforts behind 597, 598. And lastly, I just wanted to point out that, we're seeing mask mandates being lifted for travel. And as great as that is for many of us as a small inconvenience to our travel, I just really want to point out to the board and anyone who's advocating for the community as an ally to the disability system, that this is almost like a secondary lockdown for the folks receiving services with the highest medical needs and things. So I just want to ask that it's something that anyone that, who is an ally, who's traveling, to consider still wearing your mask, so that we don't, people of our community don't have to continue to avoid those luxuries that some of us can take advantage of, or take for granted, I should say. So yeah, again, thanks so much. Oh, and I guess as a last point, I just want to say that I'm very excited and honored to be considered for the CAC, and I look forward to tomorrow morning's meeting. So have a great night. Thank you.
Thank you very much for your comments, Zach. And we'll see you at tomorrow's CAC meeting. Is there anyone else for public comment?
There were additional entries in the online form, but I believe the individuals had to leave for another meeting. So I guess we could potentially open it up to see if there's anyone else online who would like to provide public comment this evening.
Okay. Not hearing anything. Is there anyone in the building tonight that wants to make public comment? Nope. All right. So we'll move on to board member comments, and we'll just move through the room here. John Paul?
Thank you. I want to thank the board for giving me the opportunity to serve as vice chair. It's a little bit about my background and experience and really why I decided to get on this board. Back in 2007, I naively applied for what was called the Community Mental Health Authority Board. And I was a 28-year-old kid, and I naively applied thinking, oh, let's try this board out. And I got passed up, but I came back about a year later and was able to get appointed to the board back then. But my reasoning for applying was, at the time, I was working in the criminal justice field, and I was seeing this revolving door of people coming in and out of the system with mental health issues. And back then, I had started working in that field in about 2002. It wasn't like it is now. There really wasn't a lot of services out there. It was just lock them up and put them in jail, and there wasn't a lot of sensitivity or thought brought to it. And even when I got on the board, that was my main goal of getting on the Community Mental Health Board back then, was to be that influence from the criminal justice field. Back then, specialty courts were just at their infancy. Those are things like mental health courts, drug courts, veteran courts, and a lot of courts didn't necessarily take them seriously. So I was really trying to push those initiatives for that time that I was on the board. Fast forward, I came back in 2018, and by then it was a beautiful thing because times had changed. Mental health is a big part of the criminal justice system. Drug treatment is, and I was seeing the initiatives that we have done here in community mental health, in partnering with things like these classes and trainings for police officers, working with the specialty courts and grant initiatives, and those kinds of things. So I'm really proud of the work that we're doing on that. But in my career, I've had the opportunity, just so you know my perspective of what I'm bringing to the board. I've served as a mental health caseworker, a probation officer in Detroit, in Oakland, a juvenile, in Oakland County, a juvenile court project manager for the behavioral health court, and then eventually a court administrator, overseeing several specialty courts, family drug court, juvenile drug court, and other initiatives that involve youth. And that's where a lot of my passion comes from, of working with youth in the justice system, because in having worked in probation for so many years, I saw there's an opportunity where you can, the kids, if you get them, you can put them on the right track, and get them the services and the help they need. With adults, you can too as well, but with kids, it becomes a little more of an opportunity because you can get them early on. Fast forward to where I am now, working in Detroit, overseeing adult probationer officers. So I have a team of probation officers, and help them direct and put forward and proceed with initiatives that are going to help people who have been involved in the criminal justice system. So that is where a lot of my experience and my passions come from on this board. It's been a tremendous opportunity to be able to serve on this board over the years. And now I also teach political science at Oakland Community College, which I've immensely enjoyed doing for the past 10 years. And then field instructor at the University of Michigan, Ann Arbor. So it's great to see one of our U of M people in our stories that inspire hope. But thank you for the opportunity, and I think we have a really good board. I've had an opportunity to know several of you, and I think let's keep moving forward and do some good things. So thank you again for the opportunity.
Thank you. Ms. Root?
I just appreciate all of the information that was reviewed tonight and the questions that were answered, and congratulations, Mr. Vice Chair.
Thank you.
Mr. Cowan?
Could someone get us Hannah's information to all of us? I was trying to pay attention to her and not taking down the name and the Instagram and what other electronic format that I don't know anything about to try and get onto. So I'll get some help from home and try to make help her business, as I'm sure others will do. Thank you.
Mr. Young?
I'm just happy to be here and settled in. Thank you.
Ms. Mamie Dyer?
Thank you to everybody for providing all of your helpful information today. No other comments.
Ms. May?
I just wanted to say thank you to both Cheryl and Hannah. as a parent of a daughter who has both spastic quad cerebral palsy and has found her place and her happiness in art, both of those stories really touched home for me. And then I just also wanted to say congratulations to John Paul and Hannah's social media handle on both Facebook and Instagram are Hannah Joy Spectrum Designs.
Yeah.
Okay, thank you. Ms. Woodruff?
Thank you for the reports that were given on tonight. It didn't leave a lot of questions because the reports were very thorough, and I appreciate that. And again, the Inspiration of Hope stories are very uplifting. You know, that's why we do the work that we do. Thank you.
Thank you. Dr. Hans?
Yes, thank you. The highlight of today's meeting was the stories that inspire. I think that's where the focus should be, on the people and their stories. And I'm happy that we are kind of going back to that format. Of course, the core provider presentations are also important, but that's a different kind of focus, and if that could be separated from stories that inspired would be really helpful, so I appreciate that. Along that line, two things. One, there was a few years ago a move to encourage people with intellectual and developmental disabilities to have micro businesses. There were some hurdles, there were some barriers to that, and I think that is an opportunity we should avail to help our people. Similarly, the peer mentor program is very, very important. A lot of the people, they just need that other person to encourage them, that looks like them, that feels like them, that have the same challenges as them. I could tell my son all day long what I expect, but he's most motivated by people that have similar interests to him and similar challenges. So I think that is important. If there could be a presentation on these two items at some point would be really helpful. My second point is, Dana, this is wonderful. This is really very helpful. I don't remember that in the recent past we have any presentation on the SED services. That is important because a lot of the issues that start are during adolescence. In my own family, extended family, there are adults now who are dealing with a lot of challenges. When we look back 10 years ago, I'll give an example. I have a grandniece who would visit our house for holidays, Thanksgivings, but my husband pointed out that she's always sitting alone in a different room. She removes herself. Brilliant, beautiful girl, high achiever, musician, athlete, good grades. Now at the age of 17, 18, when the transition from school and family support to college occurred, things really fell apart. So I think the SED presentation would be very helpful because a lot of the issues that we are facing today in our country, and considering the issues that we are facing in the Western countries, USA is at the top of, or the bottom, whichever way you want to look at it. But I think if we could focus on children, that we would see results in the next decade or so. Thank you.
Thank you, Dr. Hans. Mr. Furman.
I just want to echo the adulation for the stories that inspire. I was struck by the fact that Cheryl had an experience where she wasn't exactly encouraged to pursue higher education. I was very blessed by a strong family network who did encourage me along the way. So that really helped me. And I hope and pray that that individuals who are matriculating through school now have that same strong support network, either with family or friends, to really not put any cap on what that individual's abilities are in terms of higher ed. Again, I'd like to thank the finance team and Anya for putting together the monthly report, and it's always good to hear the director's report because it gives us a sense yet again of how much is going on in the network and how involved we are in the lives of people we serve in terms of making a difference. So again, great meeting tonight. Thank you very much.
Thank you, Mr. Furman. And I just have a couple of comments myself. I made light of it with Anya, but the numbers are important. Someone once told me, no money, no mission. So we have to watch what we have so that we can act out on our mission, which is to serve those, the people that we serve across the county and even elsewhere across the state. With what Dr. Hans just said, children are our future, so I'm glad that we are involved and we're able to help out both at our SUD with the Kids Art programs, but also in the greater communities like Oxford. It's all important across the county. And then hearing tonight one more time about CIT and how we are influential with the folks that are out there on the streets with badges that are there to help, not just the law, but with the order and recognizing there are alternatives to just handcuffs and a taser. So I think it's really great that we're out there in lots of different ways. And then one last one with substance use issues continuing to be on the rise in different kinds of ways and different kinds of things. I think it's great that we have such a well-developed program here in Oakland County in that space, because that helps a lot of people that normally would not. I wish they didn't have the situation. I wish the families didn't have the problems with drugs, but because they do, I'm glad we're there to help. And that helps a portion of the community that isn't aware of us, except if they knew someone with mental illness or developmentally disabled. So it's yet just another way or another area, and I hope to see more of that integrated with what we do around the other areas of the specialty populations we have here. So with that, we've completed our agenda for the night, so we are now adjourned for the night. Good night.